UPMC Hamot has a proud 130-year tradition of great decisions, growth, and transformation. But the past several decades have seen the most dramatic change. With the opening of a nationally recognized heart institute, an expansion of our physician network, and an affiliation with one of the most highly regarded healthcare organizations in the world. We recognize the vision behind these great decisions. A vision that continues to steer our course, to shape healthcare throughout the entire region, and to benefit our patients, now and well into the future.
Why not Hamot? Why not Erie? And we as a team saw that in fact we could do extraordinary things here in Erie, and that Hamot could be a national leader in the things that we felt important that needed to happen.
It's all about the hard work that our staff and our physicians do every day to think that we're just not going to be settling for good. It's going to be great.
I was on my way home from work, and I was passing this truck. He bumped my front right and turned me sideways to where my driver's side was facing oncoming traffic. Just smashed into me, and I was life flighted to Hamot.
Brandon's injuries were pretty extensive. In addition to traumatic brain injury and subdural hematoma, he had a cervical spine fracture. He had multiple rib fractures, a collapsed lung, which required placement of a chest tube to re-expand his lung. He had diaphragmatic injuries. He had intra-abdominal injuries, including splenic and liver injuries. He had small bowel and colon injuries, which required surgery. In addition, he had a torn thoracic aorta in his chest, which required immediate replacement with an interposition graft to prevent him from bleeding to death from that injury.
If I had to be able to pick where I needed my child to go to receive his care, it would be Hamot. It seemed as if there was almost like a family unit at Hamot, that they all kind of knitted together and worked together.
My role for caring for Brandon Bonecutter was to be his nurse, bedside nurse. I would go in and check his neural assessment, see what his needs and also what his family's needs were. And for them to come back and tell me, yes, you helped me and thank you so much, it's a very rewarding feeling.
Yeah, I'm super happy of my recovery. I mean, I'm living a normal life for the most part.
As far as I feel, I have 100% of Brandon, which was the 100% that morning when he went to work, he left as 100%, and a year later I have 100%.
Transcatheter aortic valve replacement is replacing the aortic valve, which is the main valve that lets blood out of the heart, through the leg. It's a really exciting technology because aortic stenosis, or narrowing of the aortic valve, is a very common problem, especially in the elderly.
When I first met my appointment with Dr. Ferrara, he mentioned this procedure, and he told me, at my age and my condition, I'd be a good candidate for that.
He has a number of so-called comorbid conditions that made open heart surgery pretty risky, to say the least, in his case.
According to Dr. Ferrara, the first patient for that procedure, and he was real proud of that because I'm number one.
The awesome part of this procedure is it's a team approach, okay? And we have so much expertise in the room at one time. It's really benefits the patient tremendously.
I couldn't believe it was the recovery. I was right back in and had a normal life, come out of the hospital after 2 days, walking around, doing anything I wanted to do at a slow pace.
We're very pleased to be in the so-called ground floor of this. There's not many institutions in this country that are accepted for this technology.
Because every time Ferrara sees me, it calls me number one.
On the day that we introduced this protocol to our team here, we were at a crew meeting. The tones dropped, our pagers went off, and coincidentally, the nature of the call was for an ST elevation MI.
They ended up stopping the ambulance at Kinne-Gustafson Fire Hall and ran a stable 12 lead that they sent right directly to the cath lab at Hamot. And I remember him saying, "Are you afraid?" After he was done doing what he did, he got right in my face and said, "Tammy, are you afraid to fly?"
We can actually do a 12-lead EKG using something similar to what they use in the hospital, place all these leads on the patient's chest, and we can get 12 different views of the patient's heart.
Based on the EKG itself, our suspicion was that she had 100% blockage of the artery on top of the heart. But there's this 1 to 2 hour golden window, so to speak, where we can actually salvage heart muscle. And in doing so, we can preserve heart function and ultimately affect patients' outcomes and improve their mortality.
By the time we all got there, she was in a room. The procedure was already done.
It happened so fast, and start to finish, it was amazing. I mean, we live in a rural community, and to be able to have the health care that I received in a matter of 76 or 78 minutes from start to finish, I couldn't have been dealt a better hand.
The day that we found out that we were having triplets, it was an experience.
Multiple gestations, when there's more than one baby, are often in the NICU. Mom only has so much room to carry the babies. So you're going to see twins and triplets in the NICU a lot. When the babies came down into the NICU, they needed a little bit of respiratory support, so we were able to provide that for them, but the babies really did extremely well.
The nurses in the NICU, more than anything, the way they took care of our babies, the stuff that they taught us, we felt incredibly comfortable bringing our babies home.
I mean, we're so excited that we had our babies there. We brag about having our babies there.
It was a great decision to open up this NICU with all of the greatest technology available in the region, and to provide parents with a great place to be with their babies.
It's honestly amazing to be raising triplets. There will be times that are tough and hard, but we wouldn't want or wish for anything else but it. It is honestly the biggest blessing that we could have ever been given.
A major tipping point in the organization's future, and now nearly 2 years into that affiliation, I think we're all totally appreciating the wisdom of that decision and how we have now really positioned Hamot in an extraordinarily strong way to be able to be viable well into the future.
I think the recruitment of physicians has obviously been very important in regards to growing the ability to offer subspecialties we haven't been able to offer in the past. But as an example, Dr. Brad Balot, who came here as our Chief of Neurosurgery, with the assistance of UPMC, we were able to get a high-quality physician to come to Erie and lead our neurosurgery program to a new level.
I was looking to try to make a change, and Hamot had the perfect opening and opportunity for somebody in my position in my career to come in. And to be a full-service tertiary care center in a beautiful setting like this was just too good to pass up.
I think the back problem started about maybe 4 years back. I talked to Dr. Blott because a lot of my friends whom I knew in Pittsburgh, they talked very, very high of him as a surgeon.
Many people would think would be a straightforward problem. It's something we see and treat every day. It's a small slip of the bones with a herniated disc. However, if you took 15 neurosurgeons and orthopedic surgeons and asked them their approach to this relatively simple problem, you will get 15 different answers. So Dr. Sharma wisely searched around and got many opinions about the treatments for his back and settled on his treatment here at UPMC Hamot.
When I woke up after anesthesia, I walked to the bathroom with help, and the pain I used to have was gone.
To be chosen by one of your colleagues and fellow physicians and neighbors to do their surgery is the highest compliment that you can get.
An Erie police officer responding to a call on the city's west side is struck by a vehicle, suffering serious injuries. It's our top story tonight at 11.
The day that the accident happened was just a normal day in our life, and you know, it's amazing how quickly your life can change.
I remember looking at the scan, and my immediate first impression when I saw that scan, it was a tremendous injury, and it did require immediate intervention. Mary has exceeded all of my expectations already. When many would have not given her a chance to survive, to see her in this kind of condition now is absolutely wonderful.
I'm feeling really good right now. I'm doing good right now. The hardest part is not knowing that I'm walking yet. Knowing I'm still in the wheelchair, even though I want to walk. The work they're doing is so important. I mean, I do these things for Marianne because I love her. They do it because it's part of their being.
I think when you look at Mary's case, this is really why we do what we do. We can come in at what might have been the worst time of her life, intervene, and really change the outcome.
I thanked him and told him how much I appreciate what he's done for me. Thank you for saving my life. She's a very strong woman. She's been through a lot in her life, and she overcomes and she adapts to whatever situation comes her way, and I know that we'll overcome this as well.
There's no question that our management team has been one of the finest I've ever been around. They've had vision and they've had ability to deliver. And I think the most deciding moment in UPMC Hamot's history has been obviously our affiliation with UPMC and merger. There's no question that has obviously set us apart in regards to where this organization is going to go over the next 50 years or so.
The decisions that have been made over the last few years, positioning UPMC Hamot, the strength that we've been able to enjoy by the nature of the decisions that have been made. I'm filled with optimism relative to Hamot's future, and I'm excited about the fact that the patients and the community and the region will see the benefits of this in a very personal way for generations to come.